For more than a decade, lawmakers from both political parties have stressed the need to curb the growing cost of assisting vulnerable and disadvantaged Minnesotans. During that time, state funding for health and human services has continued to inch upward, largely due to a growing state population and the ongoing pressure on many state and county programs. Commissioner Tony Lourey, a former senator who is widely respected for his work in this field, now joins me in the studio. Welcome.
Thank you, Shannon. Glad to be here.
So before we get into the highlights of the Health and Human Services budget bill, I want to get your perspective on the long-term future of assisting the state's most vulnerable individuals. Is the Health and Human Services budget growing at a pace that is unsustainable? And in your view, if so, did this legislative session do anything to bend that cost curve?
Well, we are cognizant of the growth trends in health and human services, and it's largely driven by demographics. We have an aging and sicker society as we age, and that is more care needed, and more of it falls to the public sector. That's where most of the cost growth is. In recognizing that, and those are very difficult conversations because we are a very caregiving state, and we work on this very hard. But we put together a blue ribbon panel that is charged with trying to take a very intense look at how do we try to control costs moving forward. There's a lot of ideas on the table. The goal of this is to produce $50 million a year in savings in the next budget setting cycle, and I think we're up to that challenge, and it's across the entirety of the health and human services system. So that would be healthcare, certainly a piece of it. It would be older adults, nursing home, assisted living. It would be disability services as well. It would be child care program. So I mean, efficiencies and certainly if we can find fraud, we can work on that too. So all of these pieces could play into that ability to try to take some of the trend out of our Medicaid spend.
So potentially new reforms coming down in future years to just try to keep a lid on the costs. Let's dive into some of the highlights. One that is near and dear to your heart, I believe, is the Minnesota Family Investment Program. Those families who temporarily receive assistance will get $100 more per month. This is the first increase since 1986.
Yeah.
What was the impetus, other than the time, but why did it take so long?
Every single session has its own unique set of circumstances, and somehow between the governor, the legislature, the House, and the Senate, it hasn't made the cut. It's been proposed every year that I've been here. Many people. It's never been a partisan issue. There's been a real commitment to do this, but at the end of the day, it has fallen by the wayside in every year. And you'd have to ask me in a particular year. I have a dozen years of stories about how it fell by the wayside in different years. This year, we all had a strong commitment, and we got $100 a month increase for some of the neediest families, children across this state. And it's just something that I am so proud of finally having accomplished. It is going to make a real difference in people's lives, and our programs, our public programs, really work. Families that need our assistance, they come, they get our assistance. We help them not just with cash, but also with job seeking and training and hooking up families, individuals and employers. And they get off our programs, and they have a more sound foundation upon which to build their family and be a more contributing member in their communities. Our programs really are a success story, and we heard so many of those for so many years. Getting this across the finish line, it just really is very near and dear to my heart. I've been working on it a long time.
Well, another thing that people struggling benefit from is child care assistance.
Yep.
The Child Care Assistance Program has been under criticism for fraudulent claims. Will there be enough safeguards to ensure that the right people, the neediest people, are receiving the help that they need, and those who are gaming the system are caught?
Yeah, one slight correction there. It's mostly on the provider side that most of the fraud occurs, not the individuals. And we did bring forward a very robust set of program integrity measures, really designed at making sure that every dollar that we do invest in child care assistance makes it to those families and those children that are in need of care, again, to build the family's assets, to be able to support themselves and their communities. This is a really important program that helps families work. And we are going to have attendance record changes. We have a lot more investigators on the street. We're really helping to draw a line between civil investigations and criminal investigations. We can do many more civil, and we can focus on those and really, help providers that are trying to comply come into compliance, and really prosecute those that are actually acting in a fraudulent manner. And I think we're going to have a much better, I know we're going to have a much better result from the conversation that the administration and the legislature had around this important topic.
One of the marquee issues as we leave the 2019 session behind is the continuation without a sunset of the healthcare provider tax. The Healthcare Access Fund, how many Minnesotans will benefit from this ongoing support, and how will that money be spent?
Well, to be just totally honest, every single Minnesotan benefits from the sustainability of the Healthcare Access Fund. There are 1.2 million people on our public programs, Minnesota Care and medical assistance, and that's, this is a primary funding source. The Healthcare Access Fund is of both of those programs, but it's also a tremendous investment in the health of our people, our families, and our communities. I mean, Minnesota is consistently amongst the healthiest states in the country, not by accident, but by design, and it comes from a willingness to invest in the health of our state and our people. And key to those investments over since 1992 has been the provider tax. And so removing that sunset, adjusting it a little bit, it went from a 2% to a 1.8. That was, acceptable. But we have no sunset. We have security that we're going to be able to continue to focus on how to make these investments and make them work for the people of Minnesota. Another
change this legislative session was the tax on opioid manufacturers and distributors. Yes. That money is going to pay for this ongoing opioid crisis. It seems weekly in the news there are more deaths from addiction. How quickly will better treatment and recovery efforts be available to those who need it? Yeah.
There's, the opioid stewardship fee is one piece. We also have many substance use disorder pieces within the Health and Human Services bill that DHS is working on, working with providers. So, I mean, we're improving that daily, working hard on that. The opioid stewardship fee and those funds will be available in about a year. It'll take a little bit of time. And they're going to work on prevention, they're going to work on treatment, they're going to work on some of the more downstream effects too. We have a significant investment in the child protection system, which is, we've had the children taken away because of an addiction. It has been going through the roof for a long time. So, I mean, we're recognizing all of the effects, and we're going to be working hard to implement that in a way that really helps us bend that curve as well.
Well, and a related issue really is mental health. Both for schools and communities, a new initiative will place behavioral health clinics throughout the state, and more schools will now have mental health programs. If you are someone, or you know of someone who's experiencing depression, anxiety, how do you get help? How do you find these resources?
Well, I think that the certified coordinated behavioral health clinics, we did make them on a financial footing that is able to continue into the future, and expand them from 6 existing sites today to a total of 11 by the end of this fiscal biennium. And it's really a powerful tool to bring behavioral health together under one roof. That's mental health and chemical dependency, and serve the whole person and meet them where they live. So expanding that to another 5 communities is going to be really instrumental. People are going to need to reach out to their county workers. There's statewide helplines. There's help in many regards. And one of the key pieces that I always try to stress with people is look at seeking help as a sign of strength, not as a sign of weakness. If you're in need of a little help, counseling, we have very effective tools to help get people on a better path, to lead a better life. And people don't take advantage of those tools nearly soon enough. Upon first experiencing mental health issues, it takes on average 10 years for somebody to come forward. and ask for that help. And so we're building the suite of tools. We're trying to put behavioral health together because the co-occurring disorders are so common. We're trying to not keep things in silos and really treat the whole person. And those services will be coming online. 6 of the sites are available right now, another 5 coming online. We're really excited about the behavioral health pieces of this budget.
One more thing before we go, briefly. There are more efforts now to protect senior Minnesotans. There was the fraud and abuse and assisted living and nursing homes and all of that. We have an ombudsman. We have other things that are coming in place to help our elderly population. How will these efforts improve under the care for these elderly folks, improve under Governor Walz?
Well, I think that making sure that we have protections for vulnerable adults. This is something that we've worked on for several years. I was actually the chief author in the last year in the legislature trying to get this across the finish line. Being able to come from this perspective and work with my partner in the Department of Health, Commissioner Malcolm, in getting this across the finish line was a big achievement for this legislative session. And a big kudos have to go to the legislature too. I mean, everybody came forward. This was a consensus package that's going to have assisted living licensure for the first time in Minnesota. We're going to have enhancements to the Adult Abuse Reporting Center. We're going to do a much better job of making sure that we have the backbone to protect people and information for people to understand their rights and how to choose the right facility for them and their loved ones.
Commissioner Tony Lourey, it is always a pleasure. Thank you.
The time goes way too fast, Shannon. It's good to be here.